patients back to health. With that gratitude in my heart, with that gratitude in my mind, I welcome and thank all speakers, chairpersons, and all of you who have joined us for this session. Thank you. Housekeeping for the attendees, please send your questions in the chat box because there will be time for QA. Now, friends, ladies and gentlemen, it is indeed a great personal pleasure and privilege for me to introduce our keynote speaker, Dr. Captain Usha Banerjee. Dr. Banerjee is a group director of nursing at Apollo Hospital Group. Prior to this, Captain Usha was the group head at Manipal Hospitals and Max Health Center. Captain Usha has been awarded with President's Medal, Army's Headquarters Medal, and many other coveted and prestigious awards for academic excellence. Captain Usha is also recipient of many other national and international awards like Healthcare Management Asia Award, FICCI Award, National Women's Excellence Award, and Rotary Club Delhi Central Award for involvement in social causes for women and children. Captain Usha has recently been nominated as member of the Indian Nursing Council by Ministry of Health, Government of India, as its core member in FICCI. At this time, I request Dr. Usha Banerjee to deliver keynote speaker. Dr. Usha Banerjee, over to you.
Namaste and greetings from India. It's an epic moment in the history of the world as healthcare workers, doctors, nurses, paramedics, and other workers battle it out on a brutal war at the front line, supported by back-end people. I think it's time for us to pause and pay tribute to all those COVID warriors who've laid their lives in the call of duty. We pay homage to all those patients, their families, and the citizens of our countries who have lost their lives. We also salute every single worker for relentlessly working to save lives today at the battlefront. While doctors have got great recognition in this COVID crisis, which they so richly deserve for leading the medical care in every country, I think the largest contingent, the nurses, work silently, relentlessly, tirelessly, unseen and unheard. And I think it's time for a national glorification of this fraternity and this profession. The world also gears up to celebrate the International Nurses Day, which is on the 12th of May, to celebrate and commemorate the birth anniversary of Florence Nightingale, the founder of modern nursing. Her policies of the late 19th century and the early 20th century in infection control and medical care have paved way to practice today. She was a formidable voice to reckon with. She was a voice that was heard, and she led. I take this opportunity to thank Dr. Anupam Sibal for giving the nurses of many countries to be here on this platform, and for many of them to join in to listen to what we have to say. Thank you to Dr. Tandon for giving all the guidance to make this possible today. Thanks to Professor Dr. Arun Garg for chairing this session. Today, amidst this cacophony of clinical trials, evidence-based medical practice, artificial intelligence, big data, cloud computing, which has enabled us to practice medicine and nursing with mathematical accuracy and robotic precision, one thing is very, very clear, that the role of the nurse will always prevail. She will truly be the advocate for the patient care. It's time for us to disrupt traditional power structures and for leveling traditional hierarchy. Healthcare, I represent my country, has been traditional, rigid, orthodox, and patriarchal for a very, very long time. It is important for us to position the nurse in the right manner in the organization and in the policy making in the country to ensure that we have the best practice and the best care provided to the citizen of our country. It is time for us to emulate the healthcare system and the nursing practices from the best of the world. And I'm glad I have colleagues here who stand in to state what I say. It is time for us to recognize the contributions of the nurses in this country. It is time for us as nurses to lead with our voices. Hard work isn't enough. We need to find our edge. We need to sink our roots into the earth. We need to communicate. We need to remove barriers. And we need to be titled as the heartbeat of the healthcare system. When the heart stops, it's over. We're no more the unsung heroes. We are the heroes. And it is time for the medical fraternity, for the community, for the patient, for media, for all the social groups to recognize that this profession is one of the most important professions that supports the clinicians to enable to give the best care to every citizen or every loved one who stays back in India. And I'm glad these partnerships are going to grow, and this will enable us to learn from the best of the world. And I'm sure this is going to benefit every single nurse in this country. I thank the delegates and the participants. And at the same time, I thank these wonderful participants and the people who are here on the panel, whom I know very closely, who are passionate for the cause of nursing and who've done so much for this country and beyond. I wish this conference reaches out to every single member and we grow as a fraternity, both in India and abroad. Thank you so much.
Thank you. Thank you, Dr. Usha Banerjee, for those inspirational words. I think those words will not only be heard during this conference, but they will make it real of the message for International Year of Nursing for 2021. So thank you for sharing those. At this time, I would like to introduce the chairperson for our next session, Dr. Seema Arora, who will then introduce speakers. Dr. Seema Arora is a board-certified internal medicine physician practicing in specialized medical aesthetics in Massachusetts, United States of America. Dr. Seema was chair, board of trustee of American Association of Physicians of Indian Origin for 2019-20, past president of Indian Medical Association of New England, United States, and past president of Lady Harding Medical College Alumni Association of North America. Dr. Seema is co-convener of GAPIO's Women's Forum. At this time, I would like Dr. Arora to take chair the session. Over to you, Dr. Arora.
Thank you, Dr. Garg, for that kind introduction. So I have the pleasure to introduce and invite the first speaker today, Lieutenant Susan Edamala, for her presentation. Ex-Lieutenant Susan Edamala is working as clinical nurse consultant for clinical documentation and adjunct faculty, University of Illinois, Chicago, and Rasmussen University, Illinois, Chicago. Ms. Susan is also working as COVID ambassador for the Illinois Department of Public Health. She has served as a board member at Illinois Department of Professional Regulations and was a visiting professor at Chamberlain University, Resurrection University, and North Park University. She is the only nominated Indian nurse in the IDPFR board, entrepreneur, NCLEX training business. Ms. Susan is honored with the Best Clinical Nurse by Indian Nurses at the Association of Illinois and the Best Nurse Leader nominee by Indian Nurses Association of Illinois. Please welcome Ms. Susan. Over to you, Ms. Susan.
Thank you very much for those kind words, Dr. Arora. I have only 8 minutes. I have a lot to say, but I have only 8 minutes, so I'm just jumping into my topic. Can you all see my screen?
Yes, we can.
Okay. So greetings to everybody from the United States of America. At the very outset, let me thank YAPIO for giving me this opportunity to represent the Indian nurses in the United States. It's really a privilege to be among the many eminent speakers for today. And I really, really thank you for giving nurses this platform, which was way overdue because, I think COVID put us in the forefront. So now everybody's paying attention. And for that, I have to say thank you to COVID. And, we are showing our presence in the worldwide healthcare scenario now as nurses. So today, what I'm going to talk to you is about the impact nurses have on overall patient outcomes. So WHO defines outcome measures as change of health of an individual, group, or population that is attributed to one intervention or a series of interventions. So the goals of healthcare system, no matter which country or where it is to improve patient care experience, improve the health of the populations, reduce per capita cost of healthcare, and reduce the burnout of clinicians. So what is the role of the nurse in the overall patient outcomes? We want the best outcomes for our patients. And we know that best outcomes come from clinical confidence. A doctor is present at the bedside for maybe 10 minutes, 15 minutes, or 20 minutes, but the nurse is there with the patient throughout 24/7. She's the eyes, ears, hands, mouth, everything for the patient and the doctor. So if we have good clinicians at the bedside, it directly translates into good patient outcomes. So how do we prepare this nurse? In the United States, the nurse is the coordinator for patient care. A patient may have many physicians, many specialties taking care of this patient, but the nurse is the one person who would coordinate the whole care, and she explains everything to the patient. She advocates for the patient. She is there as a representative, as a voice for this patient. So it is a big, responsible, very accountable job. You are dealing with lives. You cannot make mistakes. So it requires preparations accordingly. So the education system for nurses has been very well established from a vocation that it started. We are now a profession. And this profession gives people the degrees that they need to practice at the bedside. They can come out with an associate degree or a diploma in nursing or a bachelor's degree or a master's degree to practice as entry-level bedside nurses. After they take I'm talking about the perspectives or the way things are practiced in the United States, because I'm representing United States right now, although my training was from India, from Armed Forces Medical College. So after the nurses get this entry-level degree, they are expected to go through an exam, which is not that easy. It's a National Council licensure exam, which is the NCLEX exam that they have to take. And once they take this exam, then they are given the title of an RN, which means a registered nurse. So once they get this registered nurse title, that's when they apply for jobs and they go and start their job. So when they go into the job, they are given at least 3 months of orientation. When I came to the United States, I had 14 years of experience in India and in the Middle East as a critical care nurse. But even so, I was given at least more than 3 months of orientation into the ICU, because even though I didn't need it, that was a system, that was the plan for the hospital, the way they take in their nurses. So they make sure that the nurse understands, even though she has experience, understands everything about the healthcare delivery system in the United States, so that she becomes an efficient caregiver at the bedside. There's clear-cut job descriptions that is laid out for each nurse or what level they are performing, so that there is no role ambiguity at all. Then once these nurses work at the bedside for at least 2 years, then they're allowed to go into take up any of their certifications of their specialty. So if they are a critical care nurse, they can go in for a CCRN certification. It is not mandatory that every nurse should be certified, but nurses who want to grow in their profession will definitely be supported with advice, resources, even the money to do the exam and to prepare them for the courses some hospitals are giving them. And then they also give an extra pay for certified nurses. So this really motivates nurses to keep growing in their profession, to become better and better at the bedside. And once you get the certification, you are supposed to renew the certification every 3 years or 2 years, depending on the certification. So for that, they are supposed to keep up their latest and be abreast with the latest knowledge. So they have to keep up with the CEU. So to maintain our RN's license and to maintain the certification, for RN's license, it is 20 CEUs or continuing education units that they have to have, which means like 20 hours of education to renew their RN license. And for certification, it's 100 CEUs every 2 or 3 years, depending on the certification, so that they are well-versed and they know everything that's happening in their field of practice. We also practice evidence-based practice of medicine. And so the latest trends and whatever procedures and policies are there, that is available to the nurses at the bedside on their computers. So if for example, there's a change in policy related to how to insert a Foley's catheter, the nurses can go up online, check immediately what is changing, and the nurses are given periodic in-service education for anything that is new or that has changed. So that way they're keeping up with their skills, they're keeping up with the latest in the field of practice. Critical thinking skills cannot be underestimated at all. A nurse with a good critical thinking is the one who will save the patient, who's able to do good assessment on her patient and is able to foresee the complications that are happening and to prevent them. So that is the kind of nurses that we want in our healthcare system, right? And the most important of all is this job security, perks, opportunities for professional growth. This is something that I really think that India needs to work a lot on. If we fix this one problem, I'm sure that there will be no attrition of nurses at all. Nurses will not go looking for the job to another country. Why do nurses leave? Because nurses are not given, first of all, in our culture, I'm sorry to say this, but people look down upon nurses. People think that nursing, if you're not good with anything else, if you can't become an engineer or a doctor, then you should become a nurse. You become a nurse. That's not true. If we don't have people with intelligence and those who only obey orders, those nurses will not be saving the patients. We need people who are critical thinkers. We need people who know what they're doing. We are not there just to take orders. We should have the knowledge to question the orders from the physician. If the order is against or wrong, or if somebody made a mistake, if we didn't need to do that, there was no need for us to go for a 4-year degree course to get this bachelor's degree to practice as nurses, right? So this job security will come only if there's pay rise. They are able to have a good, decent lifestyle. In the United States, people look up to RNs. Last year, it was the 18th time in a row that the Gallup poll showed that nursing is the most trusted profession of all professions in the United States. And this is something for the nurses to be proud of. And this is something that every nurse all over the world should enjoy, that their profession is considered as the most trusted profession. And that's because of the way the society has given place to the nurses. We have good perks, we have opportunities for professional growth. The masters and the certifications that I have behind my name has come free for me because my hospital or organization where I have worked, they have paid for this. So nurses don't have to worry about, oh, who will pay or what will I do? So once these things are taken care of, then automatically the social status of the nurses will go up and more people will start coming into the profession. So patient outcome measures, what are some of the measures? I know this is like a very busy slide and there's not much time for me to explain anything here, but this is just a slide from the hospitalcompare.com where anybody can go and look up and see, you just put in your zip code of your place where you live, and then people can choose which hospital to go. What is the rating for safety in this hospital? What is the rating for readmissions for pneumonia, CHF? What is the patient care experience? How effective the care is? how good the nurses are in communicating, the physicians, how well they communicate to the patients, what is the timeliness of care, how efficiently they are using the EHR, and how transparent this data is. All these are just some of the measures. There are like 59 measures on the hospitalcompare.com. And there are other websites too, like Leapfrog and other things that people can look up. So we have a very informed consumers now. So if we want to give the best care, we have to be the best at what we are doing. So we have to be transparent. We have to make sure that all these measures are met by our organization so that people will want to come and have the best care that we can deliver to them. So there are some departmental strategies and organizational strategies. Because of lack of time, I'm not going to go over every point. If we want, we can discuss this later if somebody needs more clarification. So I would just read through just to, to respect the time. So a patient-centered care is very important. A patient should be involved in every decision that we make for his or her care. A well-established orientation plan, which we discussed. Shared governance, meaning that the nurses at the bedside should have voices and their input should be considered in making policy and procedure changes. Foster self-directed lifelong learning for the nurses. Have career ladders where the nurses can get promoted and given opportunities to precept, to mentor, etc. Succession planning for leadership is very important, and recognition of proficiencies. So this is important at development, at a departmental level. In an organizational level, we should always involve, and that is what I want to talk to all the all the healthcare leaders who are here in this podium or in this panel, that always involve your chief nursing officer or your chief nurse executive in critical decisions that are related to the delivery of care, because nobody knows that what happens at the bedside better than your nursing staff. So take their input and make use of their knowledge at the bedside to make changes in your policy so that your patients get the best outcome. Equal voice in the boardroom. Conferences with nursing representation, and this is what we are doing right now with GAPIO, that we are given a voice, we are given a day, and thank you so much for this, where we have nurses talking about us so that everybody in the world understands where we are, where we come from, and what is our input in bringing about the best that we can as clinicians at the bedside. And recognizing nurses at organization levels and visibility of leadership at the grassroots. This is something that I would like to emphasize. Sometimes we are so busy with meetings or leadership stuff that we have to do, we forget people at the bedside. So making yourself present, going and taking rounds, whether you are a CFO, a CMO, a CEO, or CNO, whoever, if you go periodically to the bedside, see what people are doing at the grassroots levels, you will totally understand what's happening and you will be able to make changes which are for the better. And collaborating opportunities at national and international forums, just like what we have now, is something that organizations should foster. So how do we unleash the potential of these nurses? I look at this in just like the Maslow's hierarchy of needs that we do. We have, and this is not new to us, we are familiar with this. So in the beginning, when a nurse is coming into the profession, she is in this level of, trying to make a living. She's working to get food, clothing, shelter for her family. So she is in the basic physiological safety and level. And then she becomes a member of the team, and she goes into this, to team member, a camaraderie that develops, and she has this, she goes into the next level, that's a level of love and belonging. And once she does that, then she becomes, a part of that unit or part of that floor, and she starts becoming certified nurse. She starts mentoring other nurses. She becomes a preceptor, and now she has a self-esteem that she is one of the best in her profession. And after this, next comes the self-actualization level, where the nurse is thinking about, oh, I have got so much from my profession. What do I do to give back to my profession? And we find policies and procedures, and we make changes. And as what we are doing now, like Dr. Banerjee and other people in my Madam Gomez, and so many other people who are actually leading their organization or leading in nursing, are actually giving back to the profession because they know what is wrong, what can be fixed, and that's the way to go. And we want all our nurses to climb the Maslow's hierarchy all the way up to self-actualization. We need to understand that nurses are invaluable assets to society, and investing in them is what is needed, because you will invest on something that is very valuable, right? So if you think your nurses are valuable, you will invest in them instead of ignoring them. You want to provide care for them as caregivers. You provide them work-life balance so that they don't quit nursing and go into something else because this is so, they are burning out in their profession. Recognize your nurses for exemplary work. That is the way to improve the image of nursing. We ourselves as nurses have to improve our image, as well as a society who is actually the recipient of our professionalism should be improving the image of nursing, accepting us as professionals with intelligence, wisdom, character, skill, knowledge, attitude, everything. Empower our nurses and then become autonomous in our practice. So we know that we can't achieve this alone. Together, everyone achieves more, and we need our whole healthcare team, our ancillary staff, our physicians, our organizational directors, people in leadership, everyone together to collaborate, to support, protect, and to promote. Only then we can bring out the best clinical outcomes for our patients. That is all I have for you now. If you have any questions, you may ask now, or maybe we can save it for the end of the day as per the plan from our organizers.
So thank you very much, Ms. Susan. I think we will keep the questions for the end. That was an excellent speech, and I think very informative about the role of nurses and the great education that they go through here. And also, I second that they're such invaluable assets, and we definitely do need to recognize and empower nurses. And that's how, we are going to, set examples and increase also the patient care, and also make more nurses come into this position, which is really, really needed right now. So thank you very much for the excellent talk. And now I would like to invite my next speaker for today, and that's Dr. Jyoti Clara Michael. Dr. Jyoti Clara Michael is currently working as Director of Nursing, IHH Healthcare, India, Glendale's Global Hospitals Group, and Continental Hospitals. Prior to this, Dr. Jyoti was associated with CMC Hospital, Vellore, India for more than